Dr. Peter Glidden, your steadfast advocate for health. Thanks for clicking through. There's a lot of talk in the public forum now because of the upcoming election about health care. Everybody's throwing in their 2 cents worth. Well, listen, I'm here to tell you all the money in the world won't fix it. We don't need better insurance coverage. We don't need less bureaucracy. These things, of course, would help the current system, but the current system revolves around a medical monopoly. The real problem with healthcare, with our horrible health outcomes, not only in the United States, but all around the world, industrialized nations, is because we haven't had a free medical market since 1912. In 1912, the American Medical Association was granted exclusive control over who could and who couldn't call themselves a doctor by the United States Congress. This was under pressure from the Carnegies and the Rockefellers. They exerted a hostile takeover of medicine, and we've been underneath their monopoly ever since. And medical doctors, your medical doctor may be the nicest person that God ever created, but your medical doctor doesn't practice medicine. Your medical doctor practices allopathic medicine. And allopathic medicine is really, really good for trauma care, surgery, emergency medicine, a handful of infectious diseases. That's the wheelhouse of MD-directed pharmaceutical centrist medicine. But for most of the conditions that most people go to the doctor for most of the time, that medical system is bad. It's incorrect. It's wrong. It doesn't deliver. It's not because medical doctors are stupid or sadistic. It's because their methodology is built upon a philosophy which is inconsistent with the reality of the human experience. Medical doctors are trained to suppress symptoms with drugs and surgery. Holistic doctors are trained to usher their patients into a state of health. There's a big difference between suppressing symptoms, managing symptoms with drugs and surgery, and helping people to get healthy. Again, look, this is an eye-opener for most people because of the monopoly that we've been under the influence of for longer than anybody has been alive. Your medical doctor doesn't know what's best for you. They only know what they've been trained in. And they haven't been trained in medicine. Medicine is a big umbrella. They've been trained in allopathic medicine. And allopathic medicine has maintained its top dog position, not because their therapeutics are better, not because their outcomes are better, certainly not because their medicines are less expensive, but through political power and persuasion exerted by the pharmaceutical industry, which is the biggest lobbyer in the United States, $5 billion a year. So look, we need a level playing field. We need a country inside of which citizens have access to whatever type of licensed and regulated medicine that they choose. And it's all covered by insurance. Wouldn't that be great? If your hospital allowed naturopathic doctors, if your hospital allowed homeopathic doctors, chiropractors, Ayurvedic practitioners, traditional Chinese doctors, acupuncturists, wouldn't that be great? Wouldn't it be great if your insurance paid for it? Well, I'm here to tell you something. If all of that happened, we'd have much better health outcomes. But, the insurance companies don't want that. The pharmaceutical industry doesn't want that. They don't want you to be healthier. And I honestly don't think any of this is going to change in my lifetime because the money and the power is too big. It's too big. When I talk about this, it's like whispering in a hurricane, quite frankly. People just don't get it. Well, some people do. If history doesn't repeat itself, it rhymes. If the story is true, not everybody got on Noah's Ark. The more's the pity. Well, not everybody listens to what I and my colleagues have to say, and more's the pity. I'm here to tell you, after 30 years of clinical experience as a licensed naturopathic doctor, that there are 2 primary steps that everybody needs to take to get their bodies into the game of healing. And the fundamental naturopathic belief here is your body knows how to fix itself, your body wants to fix itself, your body's trying all of the time to fix itself, but it needs help. Your body needs raw materials, your body needs minerals and vitamins and amino acids. There are 90 essential nutrients that your body needs just to function normally, let alone heal itself. But these nutrients are not all present in the food. Some of them are, many of them aren't. So as time goes by, your body becomes deficient in essential nutrients, and then things start to break. And then you go to the only show in town, your medical doctor, who you've been paying handily through the nose for in medical insurance premiums to gain access to, and they medicate and manage your symptoms, suppress your symptoms with drugs and surgery. You don't get better. You maintain at a subpar level, and then something else breaks, and then something else breaks, and by the time you're 60, 70 years old, you've got hearing aids, dentures, all your hair's falling out, 3 fused vertebrae, you've got no gallbladder, you've got no appendix, you've got no tonsils, you've got no uterus, you've got no ovaries. You need a prescription medicine to pee, a prescription medicine not to pee, a prescription medicine to fall asleep, a prescription medicine to wake up, a prescription medicine for the pain that you eventually become addicted to. It's a nightmare. And keep it in perspective. Thank God for insulin. Thank God for lidocaine. Thank God for the sterile technique. Your medical doctor is really, really, really good for emergency medicine, trauma care, but for chronic illness, they're horrible. Look at the outcomes, for goodness sakes. We desperately need a new way forward. And after 30 years of clinical experience, I'm here to tell you that the simple steps that you need to take are simple. You just need to stop eating 12 foods and take a bunch of nutritional supplements into your body every day or on a regular basis. Do a little in-house experiment. For me, proof of the pudding's in the eating. Go to EiffelHealth.com, EiffelHealth.com. Purchase the products that I recommend. They're right there on the front page. And take them as directed. Get in touch with the good people at Eiffel Health. They'll tell you what to do, how to take the products, hold your hand. And look to see for yourself what happens to your state of health. Because as God is my witness, your body's ability to fix itself is much greater than anybody has led you to believe. And often, all that it takes initially is filling up your body's nutritional tank with the right stuff in the right amounts. And stop eating food that's gumming up the works. Knowledge is power, ladies and gentlemen. In this case, it's so much more than that. It's a healthy life straight ahead. If you want to wait for the politicians to level the playing field here, well, I don't think that's a good idea. I don't think it's going to happen in our lifetime. There's so much you can do right now. Science-based, clinically verified. EiffelHealth.com. Optimize your health now.